I love it when I see innovation in the fertility field that benefits both the patient and the clinics. Here today is Carol Kerchow. She is a PhD in the field of infertility. She's developed a company called Art Compass that has replaced a number of operations in the lab, right? Can you tell us a little bit about Art Compass and this innovation that you have created?
Yeah, absolutely. So nice to be here with you today. And I'm Dr. Carol Kerchow. As you said, I'm the founder of ART Compass. So ART, I don't know if your followers know, but stands for Assisted Reproductive Technologies. And what ART Compass does is it provides a platform that integrates administrators, doctors, lab staff, and patients all on the same page so that people know the same piece of information at the exact same time. It also provides a suite of quality control tools for labs. And on the patient side, it really helps for the patients to be able to communicate directly with their physicians, to be able to see their cryostorage inventory, the exact PGT status of their embryos, and images, which can be so comforting to patients to know that their embryos are safe and sound and actually be able to see images of those.
I think that is such an important component. In fact, I still have my 6.5-year-old son's day 2 embryo picture up. Actually, I think by the time I got the picture, it was a blastocyst already. So it was more like day 6, day 5 or 6. But I still have that up on my bulletin board. And you're right. It's incredibly comforting to have those images and to kind of know the status. I will say 12 years ago when I went through this, we were still doing paper records.
Yeah, and it's amazing. A lot of clinics are still on paper charts. And what we've seen now recently is that something like the coronavirus can actually live on paper for up to 5 days. So
Wow.
with the digital processes coming into place in the labs, it is replacing paper. Paper can be a little bit dirty. And that's also the main stopping point of, I don't know if you've ever experienced this as a patient, when you feel like everybody knows something different about your cycle at a different time. And
Yes.
the administrators are kind of saying like, oh, hang on, I have to call over to the doctor, I have to call
Right.
over to the lab. And it just seems like people aren't really on the same page.
Mhm.
And that can all be caused from using paper charts.
That's a really good point. That's very true. Is that as a patient, you're like, do I contact my nurse? Do I contact the doctor? Do I contact the embryologist? Who do I even talk to? Do my meds need to be adjusted? So your solution is about communication, which fits so nicely into the MedAnswers Fertility Answers platform idea, right? Is that we're all about connecting the dots. And you've done this very downstream when somebody has created embryos. Does your app also give me visibility into my frozen eggs or frozen sperm, or is it centralized around, embryos?
Yeah, it definitely can. Particularly eggs make a nice picture, and I know a lot of clinics do image the eggs. Now, the sperm, on the other hand, could be kind of difficult to image. I do have some clinics that are imaging the label on the outside of the
Makes
tube,
sense.
and that
Sure.
can be really nice for patients too, because then you're assured that's your husband's name or your donor's name and the correct medical record number, the correct
Right.
birthday, those kind of things. So,
Right. That has to
yeah.
bring some peace of mind because unfortunately in our field, without these innovations, there have been gamete mix-ups, there have been embryo mix-ups. That's been part of the push towards better electronic record keeping, right? Which,
Absolutely.
yeah.
Absolutely. Yeah, and that is exactly it, Alice. Like that is the number one problem that we are trying to solve in this space, actually. So it is nice for the patients to have their own data, but really at its heart, our system is a quality control system.
Mm.
And that is exactly it. Human error can and does happen. And the College of American Pathologists says that 1 out of every 4 IVF labs is not compliant with some of the staff-related competency data and the quality control around different staff-related items. So we really try to provide labs this whole suite of tools so that everything is digitally integrated and they're not losing different pieces of information.
That sounds incredibly important. Now, how does one get started on your platform? Do you start with the lab and kind of doing that component of it? I know you offer free assessments to the lab itself. So how does it work? Is it a difficult thing to integrate? Does it take them a long time to get their patients and their lab up on the platform?
I can get a clinic set up in just a few hours.
Wow.
Migrating a previous cryostorage inventory can take some time, but for going forward with patients, it's a matter of an hour or two getting the clinic set up. So
That's incredible.
it's incredibly fast. And then for the clinics, it can also be nice because when the patient downloads the app, they're actually registering themselves. So they're typing their name, they're putting their birthday in, they're inviting their partner. So that also helps to reduce the cost and time on the intake coordinator at the IVF clinic. It also reduces the instance of errors in the birth dates and in the spelling of different names. And it also ensures that the email is the correct email because the patient can't use the app without verifying their email.
Okay.
Yeah.
And is there, I mean, I'm imagining that over time, patients love to check in with their embryos and their inventory. I mean, I would love to be looking at mine right now. I would love to be looking at my son, like, hey, you're the frozen embryos that maybe we'll get one of a baby brother out of. Look at them. They're right here, right? So
absolutely.
do you the frequency of like checking in on the patient side? Do you see that there's some, that do like to just visit?
Absolutely. And we have some clinics that are providing the patients with an update very regularly throughout their cycle as well. And I know that can, waiting for that call from the doctor's office or from the embryologist, it can just take so much out of you. Like, what happened today? Where are my embryos or my eggs in the process? And it can be really nice to have that instantaneous update. So as soon as the doctor checks over the results, they can send it right away to the patient's app.
Okay.
And it does cut down on the time for calls and contact and all of that. And it really is nice for the patients because they have much more clarity and then they can keep referring back to all of that information. I know a lot of times I've called patients and given them the update and then they call back in an hour like, whoa, I was so worried about my embryos. I wasn't really paying attention. I was just thinking like, I can't believe 3 made it to today. I'm so excited that I have 3 frozen embryos and now my husband is asking me all these questions and I don't know what to tell him because it's flown out of my head. And so that can really be helpful too, to have all that information to keep referring back to.
Oh my God, absolutely. I literally still have my paper record of like my embryo, how many eggs were fertilized, how many created embryos, when they grew from day 2, how many grew to day 3, how many grew to day 4. It's a paper record. And I still have it.
Yes.
Well, I'll never get it. I'll have it.
One of the features of our app is when you have your frozen embryo transfer, you can actually see the embryo right after it was thawed and then another image of it again right before it was transferred, because embryos do go through such a process of collapsing and shrinking down and then growing and re-expanding. And so we can capture all of that and the patient can really see and have some good insight into what becomes their little, their M baby that becomes hopefully their
6.5-year-old cat-loving boy. Exactly. Now, is the imaging technology yours too, or have you built all these integrations? Do you integrate with the EMRs? Do you integrate with imaging technology that already existed, or is that yours?
No, so we do harness some of the features of a smartphone. You can use the phone's camera, but what we see more often than not is the microscope inside the lab is connected to the computer, and the images get saved to a file. And so what we did was for labs was we actually desktop version as well. So there is the app suite. There's also the desktop version, and that's how it connects directly into the lab. So.
Okay, got it. So my app as a user is not connected to my EMR. This is a private experience for me for my embryo specifically. So like the rest of my cycle is not part of that in terms of like, what was my stim cycle like? What medication levels was I on? This is like my precious cargo. It's my precious cargo app.
It all depends on how the clinic is using the app. So some clinics have an EMR, some don't. And we're building more and more tools every day to help address the clinics that don't have an EMR. And then we're also integrating with some of the EMRs that are currently available. So,
Okay, got it.
yeah.
All right. Well, this is really exciting. Technology innovation is really driving, I think, patient improved experience. And you guys are at the forefront of that. This is super exciting. How many clinics do you already have on the platform?
So right now we have over 50 clinics all around the world. We have clinics in the US, a lot across Southeast Asia, across India, and there are a lot of countries that are just now getting IVF legalized, like Costa Rica. And so we're hoping to get some clinics there too, so they can start off with some really great technology. And one of the things you mentioned, I think, was that we are offering some of our tools for free right now. There is a free tier to the app, but we're also, during this time of IVF clinics being closed down, we have been offering free consulting and free services to help really keep embryologists and staff employed during these shutdowns, and to also get these labs, up and going and really have, very hands-on transitions for the labs.
I think it's the perfect time for them because there's been such a slowdown. They don't have back-to-back cycles, and it is kind of a perfect time for them to make some of these operational improvements, right? Because they have bandwidth to do it. And so much of it is digital anyway. You don't have to be physically present to get everybody up and running, right? I mean, you're able to do that in a few hours, an hour to 3 hours remote, which is a beautiful thing. Yeah,
now we do all of it through distance remote learning, and it's socially distance approved.
Yes, oh, that's perfect. Now, if I'm a patient and I want my lab or I want my clinic to get on your platform, is there a way that we can connect patients to you so you can help them, advocate for this solution?
Yeah, absolutely. So we are available at techteam@artcompass.io through email. And our website is artcompass.io, and our email and contact information is there. But we're also really active on social media. You can ping me on LinkedIn. I'm very open on all my social media platforms. I've actually made really good friends with so many infertility patients who I've only met online, and I'm cheering their journeys on, and then I get to see sometimes their heartbreaks. But also the wonderful times when we are able to help those patients as a field and get them their big fat positives.
Absolutely. That's amazing. Well, I think that this is a really important solution. If you're a patient, we have lots of ways to get connected. We'll include those emails and the links that Carol mentioned in the comments below. We will also make sure that we get this in front of the clinics that we work with. We have about 50% of the IVF market engaged in our app platform. And if you have specific questions about your embryos, embryology itself, or anything related to your lab and your storage that is responsible for your very precious cargo, please reach out to Carol on the platform or on all these social media accounts. Carol, thanks so much for being with us. I wish you all the best and keep up the amazing work.
Thank you so much.